Hi my beauties, my name is Dr. Stefani Kappel and I'm a board certified fellowship trained cosmetic dermatologist in Newport Beach, California. And today I wanted to do a quick post and quick video on jawline contouring and snatching of the jawline. So I'm a cosmetic dermatologist. My practice is 100% cosmetics. I see 20 to 30 patients a day and all we do is aesthetic procedures. Tightening devices, lasers, injectables, all the things. Here's a thermometer right behind me. This is like my little laser room. There's lasers in every room. But I wanted to do a video just after seeing my last patient today because there's so many patients coming in asking about jawline contouring and how to snatch up that lower face. People of all ages, people in their 30s, 40s, 50s, 60s, 70s, and even beyond. And so I figured that it would be a good topic today because everybody now is looking for a snatched jawline. So I'm literally in one of my treatment rooms, like there's a bunch of lasers and devices in here, but I want to just hop back here. I don't even have a mic on and I'm just doing this spontaneous video. I've been up since 5 and had to see 30 patients just now, so I'm not looking my best, but I wanted to do a quick video on jawline contouring because it was something that I saw a lot of today and a lot of people were coming and asking for different treatments and treatment options for the jawline. So I figured it would be a very spontaneous, fun video to do in the middle of one of my treatment rooms with my lasers behind me. Before I move on, I ask you to like, subscribe, and share this channel and this video and this content with anyone who may find it useful or anyone who wants non-sponsored, authentic content from a board-certified dermatologist. I've never taken any paid sponsorships by any companies. Half of the YouTubers now that are dermatologists are like infomercials and doing commercials for certain things. I will never do that. You won't see coupon codes. You won't see me talking about products that I'm getting paid to talk about by a company. These are just products and devices and treatments that I do every day. I've been practicing cosmetic dermatology for over 15 years, and I know what works and what doesn't, and just like to share that information with you and like to be a source of truth and honesty in a world where there is that lacking in today's world. So be sure to share this with your friends. So how do we snatch up the jawline? How do we get that really defined, sharp angle to the jawline? How do we get that AP projection, that profile that just looks snatched and well defined? So there's different treatments that we can use to help sharpen and define the jawline, and that can be anywhere from neuromodulators to fillers to tightening devices like thermometers back here. There's thread lifts, there's energy-based devices that vary with the type of energy that's delivered to the skin. But I'm just going to kind of break it down and try to simplify why these changes are happening, whether they're anatomical or they're changes that happen as we age, and kind of we lose that well-demarcated mark between the jawline and like the neck. It's kind of just all starts to blend in and become one congruent, kind of consistent cosmetic subunit. It's not like jawline, neck, and that sharpness that we once had or that we've never had and we want to achieve. So some people may be just naturally born lacking a well-defined jaw, having a mandibular structure that's just not that well-defined, or they have a hypoplastic chin, and that bothers them. So in this case, this isn't something that happens with age, this is just an anatomical variant, and things like filler, especially Volux, which was a recent Allergan launch. Again, I'm not sponsored by Allergan, I just really love the product. I was there during the launch. I've been really impressed with the results that we've been getting in clinic for people using it to just give a little bit more jaw definition, or people that have like a hypoplastic chin or just a less than prominent chin, and doing Volux in that area just gives a really beautiful aesthetic outcome. Now, sometimes we have had a nice jawline and we used to have this beautiful angle, but as we've gained wisdom and have birthdays and get older, you get something called bone resorption. The bone starts to like disintegrate and melt away. It's a sad but true fact. If you look I remember in anatomy in medical school, we look at skulls of different ages and different decades, and you can see the skull bone in the mandible actually starts to resorb, and you don't have that bony prominence that you once had, holding that skin tight and snatched. So fillers really come in handy to kind of apply a little bit of definition to that area, to make that angle of the jawline sharper, and then also you start to get bone resorption here, which can make you look jowly. There's filler that we can do in the pre-jowl sulcus to kind of define that. So fillers are a very broad category. I have my favorites. I love Voluma and I love Volux, and I use them very regularly to kind of sharpen the angle of the jaw, sharpen that mid-jaw point where sometimes it gets lost. Like if you look at a profile picture of yourself and there's just kind of this ill-defined saggy area right here, filler does a great job of filling that in, or just kind of tightening it up by adding a little bit more filler in the chin to stretch that skin out, or filling in the pre-jowl sulcus. Every individual patient is different. Everybody has different anatomy. Everybody's face is changing and aging in a different pattern, in a different morphological pattern or feature that we can use filler to kind of fill in the gaps and make you look like you did at one point long, 10 to 20 years before. So I'm not a big filler person. If you follow me, you know that, I use energy-based devices, tightening devices, lasers. Filler's not really my main go-to in aesthetics. It's great for tear troughs, it's great for lips, it's great for, jawline, but filler in other areas of the face, I feel like we're going into an epidemic of overfilled faces. So I want to be very clear, I'm not like a go-to filler person. Some providers will give their patients like 10 syringes of filler at once and they look like these deformed, puffy, cat-like people, and it looks scary, but I would never do that to any of my patients, and I really feel that fillers all have their role, but for defining the jawline, it's actually like a really good procedure and treatment to kind of get that snatched, defined look back. So moving on from fillers, using neuromodulators to kind of help snatch that up and tighten up the jawline too. That's called the Nefertiti lift. Using Botox, and it's just like 10 units per side, usually in increments of 1 to 2 units along the under mandible part of our jaw. How that works is the Nefertiti lift, it basically, you have muscles that are protagonistic and antagonistic all throughout the face and the neck, and they're all pulling on each other. So when you soften the muscles that pull down and allows the resting tone of the muscles to pull up, it just really snatches and defines that jawline with very beautiful contour. And so the way the Nefertiti or Botox jawline works is we do a little bit along here to kind of like let the resting tone of the jaw pull up, and it gives a really beautiful aesthetic outcome. Now usually this is for people who are younger, or if you're older and you have a beautiful jawline contour, it'll just give you that extra little jump to kind of put you from like an 8 to a 10, and it will just basically define that a little bit more. But if you don't have a lot of structure there in your jawline to begin with, doing Botox alone is probably not going to give you much of a result. You probably need to combine it with filler or do a tightening device in addition to the neuromodulator. So another treatment option, you guys know I'm big on tightening devices because I feel like tightening devices inherently induce your skin's own regenerative processes to make collagen and elastin to lift, tighten, and pull. And there's nothing like it. When you induce your body to do the work, the results are next level. They last longer and they're more natural. It's like going to the gym. When you work out and you stimulate your muscles and you get hypertrophy from muscular growth, you get toned, you get fit, and it's the best result ever, right? As opposed to putting, implants in, or, putting some bicep or calf implants in. You want to just go to the gym and just work those muscles out and give the natural results. So when we do jawline tightening devices, especially Thermage, Softwave is a new one, Ultherapy is another one that gets a lot of attention in the media. Thermage is my favorite because I've had the best results from it, and I've worked in plenty of offices where I have all the devices and I see which ones perform the best. Thermage for this area right here, and now it's very operator dependent, can help snatch up that jawline. And usually we concentrate the pulses, usually a handpiece comes with the 900 pulses on it, and we concentrate it from here to the top of the neck, and it's like tightening the skin on like a snare drum. It just tightens up this lower face area to help define that jawline even more. So sometimes it's a combination of fillers, or Nefertiti lift with neuromodulators, or it's tightening devices. And then the other thing that we can do are threads or thread lifts. Now, that's not usually my go-to. I perform thread lifts very frequently, and I have been doing it for years. It was a big part of my fellowship, actually. And those kind of help with adding a little extra pull above and below the jawline. You can use them in the neck to kind of cross-hatch it this way. And threads have their place and their role, but it's usually in combination with a little bit of filler, a tightening device, and thread lifts usually my last result. And then, of course, if a patient needs a little bit more, snatching of the jawline, then sometimes I'll have to defer to my plastic surgery colleagues for a lower face or neck lift, or a full vertical restore face and neck lift. So it just depends on where you're at and what you're willing to go through. And if you're a surgical candidate, most of these treatments that I've talked about are not going to preclude you from having surgery in the future, although you may see that online. Surgeons like to operate on you. They don't like doing minimally invasive procedures, so they'll say there's too much scar tissue from this tightening device that will preclude you from having surgery. And that's not the case, because I'm a dermatologic surgeon as well. I do flaps and grafts, and I did Mohs micrographic surgery for many years, and it never gave me a hard time when we were doing tightening devices on all of our patients, and we're doing Mohs surgery and different dermatologic surgeries on our patients. So I know that firsthand. So when you're looking at your jawline, maybe you see a picture of yourself and you're like, ugh, I'm losing that definition of my jawline, or I never had it, or I hate my chin. It's always good to just kind of know what the reason is. Now, is it something that you've always not liked? Is it something that's changing as you get older? And discuss this with your provider and different options, because these different treatments have different mechanisms of action and way they work. And doing one treatment, in combination with another one will give you the best aesthetic outcome, but as long as it's targeting the reason why you're seeing this loss of definition in your jawline. So I hope hope this helps. Again, share this video with anyone who may find it useful and drop a comment in the comment sections. I see you, I hear you, and I always give preferential treatment to people who are my subscribers, but I always see your comments and I'll respond and get back to you as soon as I can, and let me know what else you guys want to hear about. Thank you so much and love you guys.